The National Mental Health Hotline launches today. We've been telling you about the new 988 number all morning long. Now, IU Health clinical psychologist Dr. Danielle Henderson is here to talk to us about it. Good morning.
Good morning.
Thanks for being here. So this is pretty exciting, the hotline launching today. Why is it so important?
Well, I think it's really important, again, because as we've been talking about, especially over the last, year or so, the importance of people knowing the resources in their area and their community nationally. If they're having thoughts of harming themselves or if they're having concerns that someone else in their life might be wanting to harm themselves. And so having this number, a relatively easy number we hope to remember, I think is really beneficial and can add to the resources we already have.
Earlier we were saying that this is similar. Think of it like 911, but instead 988. Why is something so simple like that, a 3-digit number that people can reach out to, significant in a way that really will be crucial in helping people dealing with mental health issues?
No, I think, like you said, it really kind of clears things up or makes things a little easier, hopefully, to remember, as we've all hopefully now been accustomed to 911. We know those 3 numbers. We know the services that will come to us or that could be available to us when we call that number. And the same hope is there with a 988. And now having that focus on the mental health, I think, will be really, really important.
What's interesting with this as well, some people might be hesitant to talk to a person, but they can text. Why is that an important change?
I think, again, like you said, sometimes it's hard to say certain words out loud. It's hard to know really what to say verbally, and through text messaging. Sometimes for some people that is just an easier way. I think, again, in our society where a lot of us are accustomed to texting, and sometimes too we might have difficulties that make it hard to speak or have our speech understood. And so maybe reducing a barrier for people could be helpful with the texting.
Specifically here in Indiana, why do you think this will be so helpful?
Well, since 2016, we've had more than 1,000 Hoosiers die by suicide. And so it's really calling for the importance of a resource like this in our community. Again, I have to say, adding to what we already have to benefit our Hoosiers.
Yes, because Indiana does have 211 and the crisis help hotline. So it just seems like adding even more access to help is a good thing. Anyone that's out there maybe hesitant or dealing with internally some mental health issues, what would you urge them to know and recognize with themselves?
Well, I would, again, like we were talking about with the 911, encourage them to think about, when you call 988, you can call it if you're having concerns yourself about harming yourself, or you have concerns that a loved one may be experiencing those thoughts. You'll be connected with someone who is a trained counselor who can help you with the concern that you're having and connect you to the appropriate resources. And their purpose there is to help you and help de-escalate the concern. So you will get the appropriate help that you need.
Dr. Henderson, thanks so much for helping us understand this new program. We appreciate it.
Thank you.